children's therapy service and how we will be working in schools going forwards. I'm aware that quite a few people may access this via the recording that we're making, which we will post on our website, so welcome to you too. So firstly, I'll just start with some introductions. I'm Sarah Siddons, and my colleague Louisa Waters, who hopefully you can also see, is also here with me, and we're the therapy managers for the Children and Young People's Therapy Service, which is provided by East Kent Hospitals Trust. We also have Michelle Ellis with us, and she works for Kent Community Trust, and she will be presenting a slide on their services into schools, and it will also be available to answer any of your questions on that slide. So as an overview for what we're going to be doing this morning, we're going to be talking about school visits, how we might be working virtually, how we're going to work together, referrals into our service, what our duty of care is, and how we kind of see the future. So there's quite a lot to get through. There will be a recording made of this session, and this will be available on our website, and we're also going to do a written version of the questions and answers so that people can access that after as well, because often there's very useful information that comes up in the Q&As that other people would find useful. So there'll be an opportunity for you to ask questions, and we will endeavour to answer these at the end of the webinar. Please can you post any questions that you might have in the Q&A section, and if you're looking at your screen you'll see that there are 3 dots towards the bottom of the screen towards the right hand side, and if you open this up you'll find a blue circle that says Q&A, and you can post your questions via that. If there is a specific link to the Q&A or the recording of the webinar, we will let Nick Andrews know, who's the Area Education Officer, and he can then forward the information to all of you. We will also let our therapy team know so that they can direct anybody who asks them. So we thought we would just update you about what's been happening with our service since the lockdown at the end of March. We redeployed the majority of our staff to support the COVID response into the acute sides, and most of us worked on adult wards at the William Harvey, the Kent and Canterbury, or QEQM. We left a skeleton staff behind to cover any urgent work that came into the therapy service. So that included things like deteriorating conditions, urgent equipment needs, and any children with urgent feeding needs. During this period, we shut the service to paper referrals, and we only took referrals via our phone line, which we ran 3 days a week. Over the summer, all of our staff have come back, and at the moment we're working towards reviewing all of our current open children, so all of our current caseload. We are doing the majority of our work virtually, and the service reopened 2 referrals at the beginning of last week. We'll talk a little bit about that later. So the idea of this presentation is to give you the opportunity to know what we're doing and to ask questions about how we will be working with schools going forwards. We're aware that you should have received the Children's Community Health Services Statement Education Setting document, which was co-produced again across Kent and Medway by KCC, the health providers and health commissioners. So hopefully you're all aware of that document and have seen it. So we're going to make a start now with the presentation. So first we want to talk about school visits. So as a service, we're going to be doing our appointments virtually wherever possible. However, we might still need to do a visit to an educational setting, and this could be in order to understand the child or young person's needs, in more depth alongside peers or in collaboration with teacher experiences of classroom activity. For example, this might be particularly likely for a child who's going through an EHCP process for assessment. We may need to come in to deliver interventions to address a need that cannot be achieved from a delegated programme or intervention plan, which you would be delivering by your school staff that we would train in this. So we may need to come in to manage equipment needs or to deliver therapy into the SRPs. We may need to upskill the workforce of specialist medical or health techniques, demonstration and review of equipment, feeding care plan training, etc. Although we'll be offering the majority of our general training virtually, where training is bespoke for a particular child, we're likely to come into school to deliver this in person. The other area is to let you know is that NHS staff will be wearing PPE for all face-to-face visits. So we will be wearing masks, gloves and aprons when we come into school.
Okay, good morning. I'm Louisa, I'm one of the therapy managers. Just my turn to move on with the presentation. So I'm going to talk to you a little bit about how we anticipate the virtual appointments working. So the sorts of things that we can see taking place in a virtual appointment might be having a conversation with a child or young person to agree the short and long-term outcomes. Obviously, we would do that in conjunction with you as school staff, but also in conjunction with parents and carers. We might include planning interventions and support, identifying what matters to the child and young person, what matters to their family, what matters to you in schools and other services. And we would be using those virtual appointments to co-produce an intervention plan once we've identified the needs and the goals, and help you to work out how you can integrate that plan into the curriculum. In addition, we plan to work collaboratively with particular schools to look at what that school may need to do in order to help the child or young person to achieve their outcomes. So we may do some virtual support in terms of delivering therapy programs, moving a child on to the next stage of the program if that's needed. And then also the provision of remote training, so events like this, but also for some of our other training. I know that there are plans in place, particularly for selective mutism. There is a recording now of the selective mutism training, which will be going onto our website, and that will be available to everybody to attend prior to referring a child in for that need. But we'd also use our virtual appointments to signpost you to other support and signpost parents for other support that they can receive, both universal targeted and specialist. So when we're doing virtual appointments, it's really important that we can work together. And when we were looking at this presentation, we were thinking very much about what we needed from you, and thought that no, actually we needed to start with what we're going to be promising, what we're going to be doing to help you and to support you to make these virtual appointments work. So we commit to contacting you, agreeing the key priorities, including talking to you about which children really can't be seen virtually and will absolutely need a face-to-face appointment. So we'll be having those discussions with you. Setting up the virtual appointments and sending you the link so that you can join and the young person can be there, the child or young person can be there with you in that appointment. And the beauty of that is that parents, if they're at work, can still be part of the appointments, they can still be part of the therapy, so that we can really get that engagement going, hopefully in a more joined up way. We will also promise to advise you of any resources you might need to have ready for the appointment. So we won't halfway through the appointment say, oh, by the way, could you just go and get that child's standing frame that we need to see them in and put them in it. So we will advise you of that prior to the appointment. And what we would need from you. So you'd need to have Wi-Fi access, because the appointments do take quite a lot of internet access. You'd need to have a computer with a webcam and audio so that we can see and hear each other. A laptop generally will work best for this. You'd need to provide a member of staff to support the child and young person. Now, this is no different from when we come in for our visits. We do ask for a school member of staff to be with that child or young person for their therapy appointment. So we're hoping that this won't cause you any additional pressure, because it would be the same as if we were coming in. And also a quiet, confidential environment free from interruptions. Again, much as we would expect if we were coming in to visit the child face to face. And any resources that we would ask you to bring. So if it wasn't things that we would expect you to typically have in the classroom, we would certainly send you things that could be printed off and you'd be able to use for that.
So, new referrals. As I've already mentioned, our service reopened to new referrals on the 1st of September. All of the information is up on our website, and we have made some changes, including that all referrals are now to be emailed in rather than sent in by post. So hopefully this will actually make it easier for you. So please look on the website for the referral form and all of the referral information. We are expecting to have evidence of universal support, which you'll put in place before you make a referral. So, for example, language link or speech link, that you would assess them, you would put the intervention into place, and then you would reassess them before making a referral, and you would need to send that information with the referral, because obviously if they've made good progress with universal support, then we don't need to see them. Part of the reason for this, we always did want this information before, but also children obviously have been out of school for quite a long time, and it's important for them to be able to access universal support and have a period of time where they can consolidate the learning from that. So we will be asking for this evidence.
I think it's probably important to say that those children who are urgent, who've got things that are conditions that are deteriorating, or for whom you notice that they have a new issue around eating and drinking, or something that's going to be risky that would fit within our urgent criteria, we wouldn't say, oh, go away for 2 terms before you bring those in. Those urgent children will still be accepted as a priority. So I just wanted to make sure that we'd got that clear.
Thank you, Louisa.
I'm going to hand over to Michelle for the next slide. No, we're not. Another one.
I was just about to say, actually.
Would you like to do that one, Michelle?
No, thank you.
So obviously we provide a specialist level of support into schools. So we need to be sure that we're only working with children whose needs can't be met through a universal offer. So we've already mentioned that, really. And then there are the children that access Fizzy or Clever Hands, that sort of level of support. If you do have children in school that when they've come back in and you're thinking they don't actually need us anymore, we would appreciate knowing that, because obviously we don't want children sitting on the waiting list if they don't actually need to see our service. While we've been forced to work differently because of COVID, we are keen to learn what we can from this experience, and I think there will be some silver linings from this and new ways of working that we're going to find actually work very well. So going forwards, we will be evaluating the new ways of working in order to identify things that we might actually want to carry on doing. And we are hoping, as Louisa previously mentioned, that actually having virtual appointments might allow parents to join us more easily with their children's appointments. So we're hoping that that might actually be a positive outcome from all of this. So the next slide is Michelle's slide, so I'll hand over to Michelle.
Thank you. My name is Michelle Ellis. I'm one of the team coordinators for school public health. My team is the north of the county. Unfortunately, Chris, who covers the east, is on annual leave at the moment, so I'm covering for her. It's just to say, really reinforce that during lockdown, most of our staff was redeployed as well, but we did still accept referrals, and we are now starting to reset our service. So our SPA was still open during this time and still remains open, which is our single point of access. So the numbers there on that presentation. And the referrals are continuing to be accepted through the online portal. So, and you have the link there for the online portal. Most of our staff, as they've come back from redeployment, we've managed to reset the service and retrain, and also how we deliver the care. As with the therapy service, most of our care will be delivered virtually. So whether it's to primary school children or secondary school young people as well. So we aim to triage these referrals within 24 hours to see whether they meet our criteria. And all the initial assessments are completed on the phone. So also, I think some people may ask about the NCMP and the screening that we usually do with year R pupils. At the moment, that is on hold. We're waiting for some direction from our commissioners at KCC. With the NCMP, we're still waiting for an update from Public Health England, and that should come in October as to what we are doing with the NCMP. A lot of the awareness sessions are now gone virtually, and we have delivered those, and the schools that have taken part have been really positive. So we deliver training for asthma, epilepsy and anaphylaxis. And at some point we probably will be attending schools, but I know every school has a different policy at this moment of accepting outside professionals. So we will aim to work in partnership with schools to meet the needs of children and young people. So I hope that's answered your questions, and if you want to direct anything towards me, please do.
Thank you, Michelle.
Okay, so we'll have all the questions at the end for all of the slides, so do have your questions for Michelle as well. So the next slide really is talking about our duty of care. So we do have a duty of care open to every child who has already been assessed by one of the children and young people's therapists, and so those children who were accessing the therapy services prior to the lockdown. Now, obviously, these children need to be reviewed. We need to catch up to date with what's happening with them. The urgent work, as Sarah explained, has continued throughout this period of the pandemic, but the more routine work hasn't been. And we are now starting to catch up with that, and therapists are getting in touch with all of their families and the children and young people. This is going to have a knock-on impact on waiting times for new assessments. And we know that that's particularly an issue for speech and language therapy, but it will also impact on occupational therapy and physiotherapy as well. We have to have to comply with our duty of care to our current children before we take on anybody, because once we've assessed them, we then open a duty of care. And if we haven't got capacity to catch up with the work that we've missed, we won't be able to pick up new referrals. Having said that, all new referrals are going to be prioritised based on clinical need. And if a child has a significant urgent clinical need, then we will be picking them up, because obviously that does need to be a priority for us. We have been looking at the government guidance, and we're working with our colleagues across KCC and commissioning, as well as across Kent and Medway. And it's very clear that children who have SEND should receive full educational and care support, and that therapists should be providing interventions for pupils with SEND. We will be looking at those children, we will be prioritising them along with the rest of our caseload, and clinical need has to be the top priority, but we will support you with anything that can be delivered educationally as well. We do welcome the opportunity to work together to try and ensure ongoing access to services. And we do need to know that individual schools will have their own concerns and their own issues, I believe that you should have had a statement sent to you all about working and how the health services are going to be working back with schools. And if as a school you felt that there were circumstances that meant that we couldn't visit if we did need to come in and see children on site, then you must contact one of the key leads that was in that document. So I think for East Kent, it's Helen Weymouth, who would have joined us today, but she's on annual leave. And in the rest of Kent, it's Marie Hackshall, and in Medway, it's Carol Campbell. So if you are needing to say that you feel that you cannot have health staff in your site, then you must let us know. We will assume that it's okay unless you've informed us.
So thinking about the future, we're planning to obviously deliver a service as we've outlined, unless the status of the pandemic changes and we are again instructed by central government to step the service down. We are aware that obviously the levels of infection with COVID-19 vary across the country, so it's possible that Kent or areas of Kent may go into a local lockdown in the future, so we would have to respond to this if we have a hotspot. Where we are seeing children face to face, that will have a bit of an impact on our capacity because we have to apply strict infection control measures. We have to clean in between children, so that actually means in a set amount of time we're not able to see quite as many children as we would have done before in order to apply the infection control measures. We have had to adapt some of our assessments where we're not able to clean things in between. For example, some of the assessments require the use of little soft toys or figures. We've had to do something different with these because obviously we have to apply these strict infection control measures. Engagement with parents is likely to be virtual, and this may cause problems for some families. And we're hoping that where this is the case, that you might be able to help us with this, in that perhaps the parent could come into school to access the appointment with their child, which would be very helpful if you're able to do this, because we're aware that for some parents, they don't actually have anything that they can access a virtual appointment with.
There is actually a lot of work going on across Kent and Medway around IT poverty and IT access. So there are some ideas of ways of dealing with this, looking at possibly giving a locked down iPad to families so that they can access appointments. So if you are aware of families who you know are not going to be able to access, if you want to let us know, then we can sort of talk with the commissioners and the teams who are looking at trying to provide some solutions to this. I just wanted to add around the assessment procedures, because I'm sure some of you will be interested in what's happening with the neurodisability, the neuro development pathway, and looking at particularly the diagnosis of autism. The assessment that we do for autism is not able to be taking place at the moment because of the nature of how you're looking at interaction. We're not allowed to do that with a mask. So the ADOS, which is our standard tool, is not able to be being used at the moment. There has been a new development of something called the BOSA, the BOSA, which we are just in the process of getting started with. And this is a very short observation that we do through a virtual means, and parents are asked to engage with their children, and we observe that it is a very, very brief observation, and it relies, to get a diagnosis using that, we're relying very much on the whole range of information. So the better information that we have from schools, the easier it's going to be for us to reach that diagnosis. So there are going to be some delays in that diagnostic process at the moment, but we are starting to, as I say, carry out these virtual BOSA appointments. We do have a few challenges in that once they come back from a parent's house, the equipment has to be fully cleaned and then left for 72 hours before we're allowed to use that kit again. So we have had to purchase quite a number of kits to be able to do these procedures, and we can't do huge amounts each week, but it is moving forward, and I just thought that would be something that would be useful to share. And that leads us to your opportunity to ask us any questions. So I'm going to stop sharing this slide presentation so that we can see your questions. Looks as though there are none so far. If for any reason your system isn't allowing you into Q&A, there is also a speech bubble, a chat bubble at the bottom. You can put things through there as well if you can't find a Q&A. Oh, we have a Q&A here. Still typing. I know, I realised that you were probably all too busy listening to us, weren't you, rather than typing your questions. Now I can't see it. I have a pupil who was referred for speech sound therapy, severe speech sound difficulties before lockdown. Presume there's some more. To children, I'm assuming this is probably going to be a question about what's happening with children who are already on the waiting list. So they will remain in the position that they are in on the waiting list, and as soon as we have managed the children who are open to us, and staff have capacity to take children on, they will be taking on those children from the waiting list. So that would be a priority before any new referrals that come in now. So if your child was accepted to the waiting list, then they will still be on there. But it is, if you don't hear anything, it is worth checking. He's unintelligible, listed with SALT as urgent. So it will be urgent in terms of the level of his communication need, but he would still, because it's not a deteriorating health condition, he wouldn't have fit our urgent criteria prior to, during the lockdown. So he will be on the list to be seen. But it's always worth giving the service, dropping the service an email, and they'll be able to tell you where he is and what the likelihood is in terms of timescales for him to be seen. And when might he be seen? Again, it depends where he is on the waiting list. I think you'd need to ask your local team. We haven't got a schools therapist. How do I find out who that is now? Again, I would suggest that you contact the generic email address. So depending on which locality you are, it will be one of the CYP therapy email addresses. What we'll do is we'll add them to this presentation and make sure that that goes on to the, when we add the presentation to be sent round, we'll make sure that the email addresses for the localities are on there. Anybody got any other questions or anything for Michelle around the school nursing? No. Okay, well, this session has been recorded. it will be going onto our website. So if anybody wants to rewatch it, they're very welcome to. We will send the slides out through Nick as Sarah suggested at the beginning, and we'll make sure that the link to the website hopefully will be on that as well. Thank you for listening, and we hope it was helpful for you.
Thank you very much, and hopefully you're all settling back into being back at school well as well.